Frazier, Harkins, Hickman, Hill, Hobson, McMahon, Parks, Polk, Tate, Turner Ford, Wiggins.
Thank you. We will not be considering any legislation today. I mean, we'll not be voting on anything, so it's not necessary to have a quorum. The House passed House Bill 1502, which deals with hemp. As you know, there was a proposed committee substitute that just frankly, with all the chaos, we ran out of time at the end of the previous deadline. Fortunately, everything that was contained in our bill is germane to this bill so that we can get where we want to go if we figure out where that is. Today, we're going to hear first from Dr. Edney, who is the state health officer, and people in concert with him. Dr. Edney, if you and yours will come forward, and I'm just going to let you introduce people, and we're beginning with a focus on the public health implications of intoxicating hemp. So Dr. Edney.
Thank you, Mr. Chair. I appreciate the invitation to be with y'all on this important topic. And I have Dr. Robert Welch from the National Center for Cannabis Research at Ole Miss. Dr. Welch is going to begin by presenting the pharmacological issues that are of concern from a public health standpoint in terms of intoxicating hemp. And then I'll be happy to visit with you regarding our viewpoint from the Department of Health and then answer any questions. Thank you, sir.
Thank you.
Thank you so much for having me. And where's my, no, not it. Is that it? Okay, thank you. Thank you so much for having me. And I appreciate the few minutes here to give you a few bits of information that may be a review for some of you, but it may be new to some of you. So we're going to just talk briefly about these intoxicating hemp-derived cannabinoid products that are being sold throughout the state in a number of different venues. Oh. Okay, this probably looks familiar to many of you. Not all, I want to say this before we begin, but not all gas stations sell these products, but many of them do. And these are what you might see in a store. They're usually behind a plexiglass cabinet. One product in particular that I've highlighted there on the right says not to be sold in the following states. Mississippi is one of those states, but yet it's being sold. We'll talk a little bit about the importance of this issue. Vape stores also sell these products among many other products that are not cannabinoid related. But if you think back about how this began, how did we get to having all these products just ubiquitous throughout the stores in the state? And it started with the descheduling hemp derivatives that created this perceived loophole in the 2018 Agricultural Improvement Act, known as the Farm Bill, which many of you know this bill. It removed hemp and the derivatives. That's the most important part there, that were less than 0.3% delta-9 tetrahydrocannabinol, which is the most predominant intoxicating cannabinoid found in the plant naturally. CBD, or cannabidiol, being the most predominant non-intoxicating cannabinoid found. This took it out of Schedule 1 of the Controlled Substance Act. The former FDA Commissioner Scott Gottlieb noted at the bottom there, just because industrial hemp is legal doesn't mean it can be put into food or called medicine, okay? We did a study back in 2020. If you'll recall, when after this bill was passed, you started seeing a number of stores that were called CBD stores that cropped up throughout the state. And we're not the only state that has this issue, by the way. It's nationwide, really. But we did a study in the state of Mississippi where DEA agents confiscated products for us to test, and we got 25 of these CBD products throughout the state. We looked at three main things: CBD content that was actually in the product versus what the label said was in the product. The second thing was the percentage above or below that claim. And the third thing was intoxicating THC content and also synthetic cannabinoids that were found in the product. 22 of the 25 products had a measurable amount of CBD, which means 3 of them had no CBD whatsoever in them. The concentrations of CBD range from 0.02 milligrams to 786 milligrams of CBD. Only 3 products were within 20% above or below what they said was in it on the label. So that's just to point out the variability in what people are getting, even with these products now think back that back then we didn't have this explosion of the Delta 8s, the Delta 10s, THCO and P and so forth. These were mainly just CBD products, but even with those, they weren't regulated. They weren't subjected to testing, so you didn't really know what you were buying. 3 of the products had THC that did exceed that legal limit of 0.3%. 1 product had 45% THC, very high level of THC. Most disconcerting were 4 products were adulterated with synthetic cannabinoids. So we did start seeing a little bit of an issue with those synthetic cannabinoids even back in 2020. This is just a quick explanation of how they manufacture these products. You take plant material with CBD that meets that legal definition of less than 0.3% THC. You extract and purify that compound or that plant material. You get a CBD compound. It's very easy and cheap to convert and synthesize that product by adding a number of different acids to the product to get a very highly intoxicating end product. And this one here is Delta 8. That's the structure of Delta 8. But the final product can be highly intoxicating, and it's based on how much they can also put in the product. So they can load it with a number of milligrams of either Delta 8, Delta 10, and so forth. The second study we looked at was specifically looking at these Delta 8 products. This was published in a journal in 2023. We all know that these products have neither been evaluated nor approved by the FDA for use, and their effects are not well described. I wanted to list a few adverse effects. So anxiety, elevated heart rate, vomiting, dizziness, loss of consciousness, tremors, severe paranoia, and hallucinations, just to name some of the top ones that we've seen. The final point there is that these adverse effects of these illicit Delta 8 products, and not just Delta 8, this is just what we studied, but all these other THCP and O and so forth, are exacerbated by the presence of byproducts and impurities in the products. And so that's what I want to show you on this particular chromatogram that we actually tested. This is just showing the levels of different compounds in the product. And so if you see the green circle there, that is Delta 8. So it does have Delta 8 in there. But look at all this other stuff that they don't tell you on the label that's in the product. And we found a number of compounds that were highly intoxicating cannabinoids, but they're on this graph. You can't really see it, but there are several question marks, which means we couldn't identify what the compounds were. So that's pretty concerning. And the last point here is that to get a product that has an appreciable amount of Delta 8 or THCP or THCO, you have to synthesize it. So these are all synthetic products. There's not enough naturally found amounts of these cannabinoids that you could make a plant-derived product like you can with CBD, THC, Delta 9 THC, CBG, and so forth. And I wanted to show this really quickly about some data that was published by the Center for Disease Control, national data. This is showing the amount of hospitalizations in children under 10 that have accidental exposure from taking these products. You can see In 2018, it started to ramp up after the Farm Bill was approved, and then it just kind of kept getting worse. But I think maybe more germane to us today is the data that I was able to obtain from our friends at the Poison Control Center, and Mallory Pullman is a pharmacist there that allowed me to share this data today. You can look at figure 1. This is total human exposures to edible preparations of cannabis throughout several quarters worth of data from 2020 to 2024. They get inundated with phone calls. And it's mainly, if you look at the graph on the right, or the figure rather, half of them are 0 to 12 years old, and another 15% are 13 to 19 years old. So 65% of these exposures are in children and adolescents. The final point in the green box here, this particular age group of 0 to 12 accounted for 61% of major clinical adverse events. Remember the ones I talked about previously, all those side effects. And so it's very important that we kind of, and I appreciate everyone's efforts in trying to take care of this problem, because it is a very serious, it has very serious public health implications. And so that was the last slide I had. So I'm happy to answer questions, or Dr. Edney, if you're sure.
If I could see if I've got some things straight, I should say my limited experience with any of this was when I was in college in the early 1970s. And the way one got marijuana was there was a freaky looking guy here, yonder, and there, and you could get an ounce in a plastic bag for $15. I'm not sure that the current situation is an improvement on that, but anyway, we are where we are.
Yes.
I think I've tried to think about this. I think I smoked marijuana once in my life. I don't remember much about the effect that it had on me, but I'm just about certain that on that one occasion I did inhale. But sort of trying to keep up with how the world has changed,
Yes.
it seems to me, as I understand it, one of the concerns nowadays is that the cannabis that's being sold, whether it's medical marijuana or industrial hemp or wherever it is much more potent than whatever the freaky looking guy down the hall had in the 1970s.
That's correct.
And in some instances, to use a technical legal term, really, really, really more potent. That an additional concern with these particular products is that because they're unregulated, or if there is regulation, it's not sufficient, that they're just extremely high levels of intoxicants in some of them. And the third concern is that even if the product is has not got these extremely high levels, it could have impurities in it, and in some instances, very worrisome impurities.
Yes, sir.
And that's where we are. So I don't want to put words in your mouth, but considering all of that, are you telling us that at this point, what you think the legislature should do is have at least some sort of regulation which would at least control and standardize the product in an attempt to get rid of impurities, in an attempt to get rid of extremely high levels and control the level of potency? If I got that right?
Yes, sir. And you're absolutely correct.
Well, that's okay. You can stop right there. Okay, go ahead.
Yes, sir. Oh, but you are correct that the levels of street marijuana that's illicit, sold on the streets now, back in the 70s, we tested that for the DEA, and our center has tested that since the 60s. And so what we found is a rising level of THC in street or illicit marijuana. And so that's kind of been the trend, is to just maximize the THC content by hybridization of the plants. And they figured out, of course, you get repeat customers for higher levels of euphoria or intoxication. But these products are in another category, I would say, because, for example, one of the synthetic cannabinoids that they're synthesizing is THCP. That compound is 33 times more potent than native Delta-9 THC, like you would find in a medical cannabis dispensary that's run by the Department of Health. This has nothing to do with anything that the Mississippi Medical Cannabis Program is involved with. This is totally separate. And the concern is, and I've heard this, that sometimes patients might supplement with these gas station or vape store products, even if they're in the program, or if they're not in the program, I've talked to people that said, well, why would I go through the program if I can just go to the gas station and buy a cannabinoid products and they're much cheaper? Well, it's not a situation that's safe, is why. And there's no real medical benefit to any of these products. They're just solely for the purpose of getting high or having intoxication. So versus the Mississippi Medical Cannabis Program, you have a condition that you're approved for, and you have a specific product that you know through testing in the independent labs what's in that product.
Thank you. Senator Blackwell, you have been working in this area for quite a while. Do you have questions, comments?
Sure. Back when I was in college, it was a 4-finger bag for 20.
It was what now?
4-finger bag was $20. Usually Mexican water leaf. But anyway,
I can't comment on that. So
to reality. Dr. Welch,
Heard of a 5-finger discount. I've never heard of a 4-finger.
Dr. Welch, you talked about testing that we had a while back. Are you familiar with testing we had done again within the last month or so?
with the potency of street marijuana?
Yeah, Steep Hill did an.
Oh, yes. I'm very familiar with
Could you
Cliff's
tell
group.
tell the body how many of those products passed?
Oh, there very few. And these products were these products that we're talking about. So Steep Hill Labs, Cliff Osborne's a pharmacist that runs that lab and one of the independent testing labs. They found all kind of heavy metals, pesticides, aflatoxins, and things like that are you're not going to find those contaminants in Mississippi Medical Cannabis Program products. And so I can't remember the exact number, but it wasn't many that passed that. Maybe none.
You're correct. None of them passed.
I didn't think so. Yeah.
I think there are 12 to 13 products. I think.
Yes, sir.
Thank you.
Yes, sir. Thank you.
We have with us today Senator Lee Yancey. He's now serving in the House, but of course, once a senator, always a senator. Senator Yancey has labored with Senator Blackwell in this field. Do you have questions or comments? Or we're happy to have you back.
I'll have to say that in the 1970s, I had no idea what cannabis was. I was riding my bike in Lee County, having a good time. But Dr. Welch, I'm thankful that you're here and sharing with us. And, this bill is something that, this issue is something we put a lot of work in over the last number of years. And I think we would all agree that there is a problem. Is how do we deal with this problem? And how do we leave this session without an armful of nothing like we have in the past? And, I missed some of your presentation and heard some of it. And, basically, let me just say where I've come down on all of these products is let's just test them.
Yeah.
Let's make this a testing issue and look at the 0.3% THC line of demarcation set forth by the 2018 Farm Bill and test them at the time of it's a finished form so that nothing else, it doesn't, a kitten doesn't grow into a cat by the time that it's put on the shelf. Let's test it at the final form. And if it's below 0.3% THC, let's let them sell it wherever because it's not intoxicating. And if it's above 0.3% THC, let's ban it because it's against federal law. The hemp drinks are the same. If they're below that level, then they're okay. If they're above that level, then they're not allowed. And we can prove all that with testing. And so that's exactly what I think this bill does and should do. And it needs some more work. There's a reverse repealer in it so that we can do more work. But I would appreciate everyone's commitment to try and let's get something done this session. If we do this testing, it would not put all of these companies out of business. They would still have all of the CBD products that they advertise, but they would all fall under the 0.3% THC threshold set forth by the 2018 Farm Bill.
And it would also eliminate all these other synthetic intoxicating cannabinoids, even if it were, see, that's what happened with the Farm Bill is that it was less than 0.3%, but then they add to, so that the bill really addresses that.
It gets
Yeah.
rid of the synthetics.
Yeah, thank you. Yeah.
Just regarding the one issue of the 3% level as a bright line, do you think that's a good place to draw the bright line if we're going to draw one?
Well, it has to be that from the federal standpoint. That's what the Farm Bill lays out as 0.3% Delta 9 THC, which is an adequate marker. Some might argue that it's not, but I think that it's sufficient to have a product that's not intoxicating. You can get there with that level. Yes.
Thank you. Dr. Edney, do you have comments?
Well, Mr. Chairman, you know I do.
Okay, let me say this. First of all, if members have questions, I want to allow time for that. Let's hear from Dr. Edney, and then if there are questions, I'll take a couple of questions for the committee, but we've got limited time and we need to walk a tight line between questions and running out of time. But Dr. Edney, go ahead.
Thank you, Mr. Chairman. Thank you, committee members. And I do want to point out this is not our legislation. Our position is we have a problem and we certainly will take any assignment that you think will be helpful to help solve the problem. The clearest problem for me is the loophole of measuring the percent THC at the time of harvest and then determining that to be hemp and then letting it go. And it's very clear from what Dr. Welch has shown and from the testing that Senator Blackwell is talking about that between harvest and by the time the consumer is getting it, that a lot of things can happen and obviously are happening that are moving it from 0.3% THC or less at harvest to the very high concentrations that we're seeing on testing. And I want to point out oftentimes higher than what we allow in the cannabis program. So that's quite ironic that we spend a lot of time and energy and resources making sure the cannabis program products are safe, and yet it's the Wild West with these other products. I would point out to you, Alabama took the approach of they just rescheduled Delta 8, 9, and 10 to be Schedule 1. So, done. I would agree. We all have the perception that what's on the product that is out there now is illegal, but I do think that y'all need to address the loophole and make it very clear that it is illegal. And I have the concern about the intoxicating amounts of THC that are available to all ages currently. And I am concerned about the adulterants. We do not allow pesticides in the medical cannabis program. We don't allow toxins. We don't allow heavy metals. There are a lot of things that will test product out to be unsafe and not allowed to go to the dispensaries. We're seeing that with the products that Dr. Welch showed to you. That is a significant public health concern from my vantage point. And then you have just truth in advertising, because a lot of these products are being marketed as pure CBD and they're not. And then you have products that are being marketed as low concentration THC and CBD that are just water, that is inert. There's nothing there. And I don't think any of us want that either. So I can tell you when I was in practice, and someone was coming in and was getting a prescription for a controlled substance for whatever reason and doing urine drug screens, it was not uncommon that someone popped hot for THC. And then I'm trying to have a conversation, okay, what's going on? And these were patients I knew that I really didn't think Miss Jones was smoking weed at home, but she was hot for THC at a significant level. And back then, we just, and the only thing we could come up with was she got something from the CBD store. And knowing it was not regulated, and from one batch to the next, you don't know what you're getting. I just asked her to stop using it, and she did, and it cleared, and that was not uncommon. And now in hindsight, I know what was happening is she was getting an intoxicating hemp product that she did not want, was not seeking. I, in hindsight, had plenty of patients that were trying to get pure CBD, which should not have been psychoactive, who are having significant side effects and told me they didn't ever want to take that again, which didn't make clinical sense, but now it does, now that we have more transparency on this. And the question I have is, how many Mississippians have failed drug screens at work because they were taking something that was legal, but it caused them to fail a THC test? And a hemp product should not do that. You should not test hot for THC if you have 0.3% or less product. The intoxicating part is of concern. But when Mississippians are consuming something and they think it's one thing and it's actually another that may well not be safe at all, then I do think it's time for us to step in and provide product safety for folks. I think we have spent the last couple of years raising the awareness this is a problem. There are some fairly simple solutions. I'm not advocating it to come to the Department of Health, but if it does, then we will need to work with y'all on the language in the bill, because I can't write a state plan for him. Not allowed. So the Farm Bill requires it to come from the Commission of Agriculture. But we will be happy if y'all want us involved to work with you on language that will work and try to be the problem solver that we need to be, that you expect us to be. Any questions, Ms. Chairman?
I think Senator Barnett, did you have a question of Dr. Welch or Dr. Edney or?
Either one. Thank you, Mr. Chairman. Either one could answer the question. But my question is, in Dr. Wells' presentation earlier, in his very first slide, there's a picture of a product that says not to be sold in Mississippi. So my question is, if we realize or recognize that it says it's not to be sold in Mississippi, and we do all of this testing and all of these other things that we're asking for, where is the enforcement going to come from to make sure that these items are not only not sold in Mississippi, but the products or what we're asking for is actually what's being sold? Because if we know this is a problem and we continue to let it happen, then what good is any other legislation that we do here if we're going to allow it to happen knowingly that it's happening, is my question.
And that would be at y'all's discretion to direct what agency or agencies to enforce what the state law is. I just would remind y'all, if we're involved, we don't have guns and badges. The only badge I have gets me into my office and it doesn't work half the time. So don't give me a gun or a metal badge. But I do like having partners like Revenue who have guns and badges that can step in at the right time when needed. We will defer to whatever your wisdom shows us to do.
Anyone else? Senator Blackwell.
Yes, Mr. Chairman, just for some clarification, under Senate Bill 2706, we do have regulations, and the Department of Revenue would be the enforcer of those, Senator Barnett.
Well,
Okay.
I just know that I've witnessed the same thing, but I've even tried to get legislation passed before on a lot of these stores and things that operate like this. Not only do they sell those products that's not legally sold in Mississippi, but they also sell loose cigarettes and things like this that are not supposed to be sold in Mississippi, but it goes unchecked and nobody does anything about it. But we're making sure that we're trying to make sure that this particular industry does everything that they're required to do, but I don't think we're actually trying to enforce the things that needs to be enforced to make sure that when it says not to be sold in Mississippi, it's not sold in Mississippi. A pack of cigarettes is not supposed to be opened and sold individually. That's not supposed to happen in Mississippi. So I guess I'm asking the chairman and others who is involved in this to make sure that when we put some teeth in this, to make sure that it actually has teeth that has some bite in it and not just a bark.
I'm going to treat that as a comment cleverly disguised in the form of a question. But I think your point's well taken. Anyone else? If not, thank you,
Thank you.
Dr. Neath. Thank you, Dr. Welch. We now have with us Mr. Philip Chamblee with the Mississippi Petroleum Marketers and Convenience Store Association. Mr. Chamblee, if you'll just come up here and tell us what you think we need to know, and if you'll be nice enough to answer questions, we'd appreciate that.
Thank you, Mr. Chairman, members of the committee. I appreciate the opportunity to speak with you today. As Chairman stated, I'm with the Petroleum Marketers Convenience Stores of Mississippi. Just to give you some background information, as of December the 24, there are 2,908 convenience stores in Mississippi, employs about 46,800 people, and does 2.7 million transactions a day. So a lot of stores, they're evenly distributed over the 4 congressional districts, which I find interesting. When you look at what our members do, we have, this association has been around for, well, the petroleum part since the early 50s, and then the convenience store part in the 70s when that became the way that the industry went. And one of the things that we do, and the mantra of the members of my association is we sell legal products responsibly. The convenience store industry nationwide checks more IDs every day than does the Transportation Safety Administration, to give you some idea. We have had a history of working with the state regulatory agencies on different issues. One, the Juvenile Youth Access Tobacco Act. My predecessor worked with Senator Nicole Aikens Boyd. At that time, she was practicing law for Attorney General Hood, and Mississippi was one of the first states to have a Juvenile Youth Access Tobacco Act, and it was used as a model across the nation, and we were involved in that. We have supported the ban of bath salts over the years, spice, and recently 10-eptene. These products, when you look at legal or illegal products in the convenience store market, if you are, there's types of stations. There's a branded station, which is your Exxon, Chevron, Texaco, and you have unbranded stations. If you're branded, there's certain levels of things you have to do, and they have mystery shoppers. If they come in and find out that you're selling something that's illegal, then they will they'll pull your brand from you, and that's not a good thing because a lot of people like going to a branded station, and the dealer typically wants that. The part of the bill I'm going to address right now is on the, I guess, the loose, dry flour, things of that nature. And we've worked on this over the summer with a lot of different people, and we support some of this being regulated. And when you look at this bill, that the Senate bill that we're talking about, that's what my notes are on, which could be put into the House bill. It permits hemp with less than 1 milligram of THC that is recognized as safe by the FDA. That's below the 3% standard. Bans all intoxicating hemp that doesn't fit in the definition if it has more than that, except for THC hemp beverages. Outlaws all synthetic THC hemp like Delta 8 and Delta 10. We would regulate the intoxicating hemp beverages through the Department of Revenue, and it moves the cultivation, process, distribution, and retail oversight from the Department of Agriculture to the Department of Health. As Dr. Welch mentioned, the Delta 8 and 10 is synthesized. It's causing a problem. There's, in this bill, it allows for the Department of Health to look at labeling to make sure it's labeled properly, because I think there is an issue with these products in labeling when they are attractive to a minor. We want these products age gated. Again, we check more IDs and we understand that. We want these products to be sold properly and responsibly. So we fully support controlling this market and getting rid of the products that have just sort of, for lack of a better word, was able to slip through because of technology and everything. So we would like to see this regulated. We have, none of my members, to my knowledge, are selling any of these products, but I can't sit here and tell you that they all aren't. I can tell you that not every member, not every convenience store in Mississippi is a member of my association. But the members of this association take very seriously selling legal products responsibly. And they want a product in their store that consumers can trust and not worry about, that's properly tested and marketed and ready to go. So simply, when you look at it, this bill, to vote yes on it, is to regulate and age gate these products. If you vote no on it, just leave it as it is right now. So we fully support the regulation that we're talking about right now.
Questions? Anyone? Do you have any provisions in the House bill as opposed to the proposed Senate strike all that you think are more workable or more preferable in either bill? Or
I think the Senate strike all would be the more preferable choice as far as the way we'd worked on it and everything. I think it would be the more easier and more applicable and catch more things that way, cover everything, in my opinion.
from the standpoint of the convenience stores?
Yes, from the standpoint of the convenience stores, that is correct. And as pointed out, I mean, these products are available in places other than the convenience stores, but they're the most popular, it seems to be, that everybody talks about.
Anything else? If not, thank you very much. We have with us Mr. Ricky Brown, who is with the Mississippi Beer Distributors Association. Mr. Brown, if you would come up and give us your viewpoint on all that, we'd be happy to hear from you, and we appreciate your coming.
Thank you, Mr. Chairman, members of the committee. Ricky Brown with the Mississippi Beer Distributors Association. We've been involved with this legislation since it came up last session. Due to the fact my members have been approached by the manufacturers of the intoxicating hemp THC beverages. There are a lot of beverages out there currently that are in great excess of milligrams per container. I know there's some 30 and 50 milligram products out there that might be in a 12 or 16 ounce can, and it tells you that this can contains 12 servings. So they want you to drink an ounce at a time. And I'm just going to talk about the beverage section. What my members have voted on and would like to see done as far as intoxicating beverages is treat it just like beer. 21 old be able to buy it. Have a separate license for hemp products. And the reason the bill is so big, I think it's 259 pages, is that it brought every code section in the beer statute forward to make a change from beer, light wine, and light spirit products. And we're going to name all these intoxicating products, call them light intoxicating beverages. And what we would like to see done from the industry standpoint is to put a cap of 5 milligrams per container and can only be sold in a 12-ounce container. And there'd be a single serving of maximum 5 milligrams in a 12-ounce container. The products that my members are currently selling, they are provided a certificate of analysis by the manufacturer and saying what is in there is what's in there. And they rely on these certificates from the manufacturers to make sure that the product is what it says it is. If you look at it, there again, all my notes go back working on the committee sub of 2706, and you start with section 18 and go all the way through about section 80, and all of that deals with the beer statutes, and so that's the reason that the bill is so voluminous and why we're trying to make the changes. And it's going to tax it like beer. It can only be sold where, being in the beer law, it can only be sold in wet areas of the state. And would be handled by the beer distributor to only licensed retailers. You would have a beer permit to sell beer, light wine, and light spirit products, and you'd have to have a hemp license to sell intoxicating hemp products. And in the legislation, we're asking for some increases in the permit fees. The permits that are in effect now have been in effect since 1979. For my members pay $100 per county that they distribute in, and a retailer pays $30 per year for a beer license. And we're are asking for an increase in all levels, from a manufacturer to a distributor to a retailer, increasing the permits for all three levels. And my members would go from $100 per county to $2,000 per location. And a retailer would go from $30 to $150 per location. So what the request is and what's in the language that's in the bill. So with that said, I'll be glad to answer any questions anybody has.
Senator Blackwell.
Thank you, Mr. Chairman. Do you currently have members who are selling these hemp drinks?
We do. Matter of fact, I've got two of my members here with me this afternoon that are selling these products. And one thing I did leave out, because of my members are in a highly regulated industry, both of my members that are here are both attorneys also, but they drafted an agreement that they sit down with the retailer and make the retailer agree to that they will not sell these intoxicating beverages to anybody under 21. If they catch them selling something under 21, they just quit selling to them, providing it to them going forward.
Thank you for offering that, because that was going to be my next question, if there's any age restrictions. Are there currently any restrictions on the milligrammage? As you'd mentioned before, in some states, you can get a 16-ounce can, 30, 40, 50 milligrams of THC, and in small print, it's 5 or 6 doses.
Correct.
Are any of those being sold in Mississippi that you're aware of?
It's my understanding that there are some 30 or 50 milligram products out there being sold basically in maybe a CBD store.
And you understand with Senate Bill 2706 would make those illegal?
Correct.
And your members are okay with that?
Yes, sir. And I mean, that was one of our recommendations to the working committee, was to minimize it to just one size and put the 5 milligram maximum dosage on there to be regulated in a responsible product, in our opinion.
And one last question, are any of these products being sold in restaurants?
It's my understanding that it is.
Thank you.
Yes, sir.
Anyone else? If not, thank you, Mr.
Thank you,
Brown. We
Chairman.
appreciate it. It's been very helpful. We now have with us Mr. Emmanuel Williams with the Mississippi Small Business Coalition. Mr. Williams, and those who are here with you, you're welcome to come up and tell us your point of view on all this.
Whoever knew that the son of a preacher and a deacon would be talking about hemp at a hearing at the Mississippi State Capitol. Glad to be with you here today. Thank you, Mr. Chairman, for this opportunity to speak with you and the rest of the team here and the board here and the members on this committee. I want to first say that the folks that I represent, the Mississippi Small Business Coalition, which comprises 500 retailers who sell these at federally legal shops right now, none of them that I know of are selling to underage kids. Nobody wants to knowingly sell a product to a child. We don't deny that there aren't some bad actors out there, just like there are in every industry that there is that you have. But we're saying properly regulate. Don't ban a product that's been federally legal for the past 7 years. Regulate, tax to the degree that is fair and commensurate with the product. Don't allow youth, folks under 21, to have access to that product. Make sure it's properly tested. If my folks sell improper products to the wrong folks, or period at all, we're talking about all types of lawsuits and issues being at hand. Nobody wants to put any bad contaminants or poison into anybody's body, not any of the folks that I represent. Mr. Bill Wickstrom, who's with me today, who's a part of the Mississippi Small Business Coalition, can talk to you about how he and other members of our coalition and our team and our members are working with manufacturers, and they don't sell products unless they are reputable manufacturers. That's period. And so we are pro-regulation, just not for regulation that bans folks who are legally doing business in this state, who are adding to revenue in this state, continuously generating revenue. I think that there's a way to do this in a way that protects the consumer, a way that protects children, but also that takes care of small businessmen in Mississippi. And that just doesn't hold up folks from out of town and out of state. And I'll yield for any questions at this time.
I assume you're familiar with the bill that passed the House and with the committee substitute, which is now before us in the form of a proposed or potential strike-all amendment. What is there in either the House bill or the Senate proposal that would have an adverse impact on your members?
The concern is that the bill as written, and Senator Blackwell and Representative Yancey can correct me if I am wrong, but my concern and our concern is the bill as it is written currently would basically eliminate and ban the legal products that my clients are selling. And not just at the 0.3% level, period.
What are the legal products that would be banned that you're concerned about?
From what I understand, and Representative Yancey, you can correct me if I'm wrong, I'm open to that. Our folks aren't knowingly selling anything that's over 0.3%. But I think the way that the bill is written, it would ban and eliminate all those products, period. All of it, the specifications in particular sections of the bill go to everything that doesn't include our products, which is hemp, of course.
Again, what are the specific things that they're selling that they wouldn't be able to sell under this bill?
That goes to the legal products that are in their shops that are federally legal by the USDA from the Farm Bill as the bill is written. That's the main concern, Chairman Ryan.
But can you describe some of these products that are federally?
It could be gummies, it could be bud, it could be whatever those products might be that contain that THC level.
Okay. Are there questions for Senator Blackwell?
Thank you, Mr. Chairman. Thank you, Mr. Williams. You mentioned the age. Or is there any age restriction on any of the packages that of these products being sold in the convenience store?
Mr. Wickstrom, Chairman Bryan, if he's a retailer, if he can speak directly to that.
Sure.
Perfect.
That would be fine. We'd be happy to hear from him, Mr. Wickstrom.
Thank you all so much. Greatly appreciate it. May I have your question, please?
Yes, sir. Is there any information on the packaging or labeling of the product that says you got to be 21?
Okay, that's a great question, because when you look at it from a retailer point of view, me specifically as a vape and CBD shop owner, the oldest vapor company in this state, by the way, since 2013, I have always gone by what the minimum age is. So for example, the hemp bill doesn't really specify, we looked at the age of 18, but recently when under the previous Trump administration, when they moved the vaping age to the age of 21, all right, we not only did that for our vapor products, but we also did that for CBD products. Not every manufacturer will put that on their packaging. And that's where we think smart, sensible legislation comes in, where we look at this and making this age restricted. And so that way, when we're checking these IDs, unlike other businesses out there, we are very age restricted. And as you can see from the FDA youth tobacco surveys and stuff like that, Mississippi age restricted shops are less than 5% of youth sales here in the state of Mississippi.
You do that. How about the other 400 and some odd members?
Well, I can't speak on their behalf as to exactly how much they do, but if you look at those FDA youth tobacco surveys and you see that only 5% of us age restricted shops, that means that we have a 95% success rate on minimum in the past 5 years.
Right. Mr. Williams talked about testing of products, but you heard testimony earlier of products being tested and failing. In fact, just within the last month, Steep Hill did another, I think 12 or 13 facilities. They went out within the community, bought these products, and they all failed. So how are you, I know you're getting a COA, or are you getting COAs on these products?
My personal requirement for my business is that I vet the products before I bring them in. I demand that a COA be sent along with those products so we can confirm to make sure that they are in fact testing out at what they're supposed to be, because I'm not interested in trying to get in any trouble and jeopardize a business, especially one that I've spent more than a decade building. And I think that's where smart, sensible legislation comes in, is demanding in this legislation that there should be COAs attached to these products that go in, that should be kept on file inside these age-restricted businesses.
Right.
Florida has an outstanding model that we can look at, so you don't have to reinvent the wheel on this.
And sort of to my point, you're getting a COA. These products are being tested. You're not independently testing them to verify the COAs, are you?
I firmly believe that as the retailer, it is not incumbent upon me. That's like asking me to go test somebody else's gallon of milk.
Well, wait a minute. As a retailer and as a consumer, I'm coming to you and I'm assuming the products that you have on your shelf you're selling are safe.
I think,
So I'm not hearing that from you.
I think the point that Bill is getting to, Senator Blackwell, is that once he checks with the manufacturer, well, one, he's only doing business with a manufacturer that's reputable in their business period. That's the first part of it. Two, once he's asking that manufacturer for a verified analysis of what their product, he's understanding that to be the verified and understand amount of what's in that product.
Correct.
And he's not going to sell a product that doesn't pass the muster from that regard.
And what I'm saying is testing of those products by an independent lab have shown them to fail. They do not contain what is on that COA. And so that's where the rub is with these particular products.
Listen, we can't speak to that. All we can say is that for us, for the members that we represent, the two guys that I have with me in the room, they aren't selling to folks under 21. They're working to the best ability that they can to make sure that they're selling safe products. This is unencumbered territory. We're talking about an industry that is essentially only 7 years old. And so it's going to take putting in place some regulations, which we're pro-regulation. We're pro having good, safe legislation that protects children, that protects the consumers, but that also keeps folks who are trying to do business the right way. Senator Barnett brought up enforcement. We absolutely think that folks who sell to kids, underage kids, and who don't do what they're supposed to do should be put out of business. But for folks who are trying to do business the right way, who don't want to harm children, and who just want to make an honest day's living and employ, we're talking about 2,000 locations, 500 stores. Not all of these folks are trying to do the wrong thing, Senator Blackwell.
I understand.
May I add to that?
Sure.
Yeah, we're all about smart, sensible legislation. And in fact, we would like to look at something along the lines.
Speaker.
Oh, I'm sorry. We're looking at like something along the lines as part of that smart, sensible legislation. Let's get out some licensing and tie it to that location. So with a 3-strike rule. So if you're not doing the right thing, you regulate yourself right out of business. And that way we can really channelize and take care of this and work very hard at preventing sales to youth and for bad products.
Certainly understand your position. Ours in the Senate is to protect our constituents. And evidence has shown, testing has shown that a number of these products do not contain what is on the COA and therefore could potentially cause harm to these individuals. And that's something we want to see eradicated. There's some very smart people who took advantage of a loophole in the Farm Bill and pat them on the back. They've been very creative with creating a new industry. But other states, I think there's 17, maybe 20 of them at this stage that have banned these products. And we're just following suit with those states. Thank you.
Let me try again to get a description of the products that you are selling that you would not be unable to sell if some version of this became law. I understood gummies was one answer, but what specifically are the products that you want to sell and are selling now that you would not be able to sell if this became the law?
Well, I'm not exactly sure how this would work out if you pass the legislation, because when you're looking at this based upon the 2018 Farm Bill, when you're looking at a 3% by weight, by volume kind of deal, will this affect that? And what will it do with the additional cannabinoids that are inherently part of the hemp plant? So we're not exactly sure. Is this going to be a blanket coverage to basically strip us of the ability to sell federally legal as per the Farm Bill products? So we're looking here at more of a dry weight basis and the additional cannabinoids as well. And I've heard people in front of us speaking to the effect that when you're looking, you're talking about things such as CBN, CBG, there are 6 other, there is a total, CBD is a blanket coverage. So I'm not exactly sure where this bill would take us on that.
Okay, Senator Wiggins.
So I don't know much about this, and in a way I've actually I have enjoyed listening just on this. So I don't really have any preconceived notions, but I'm going to go back to Chairman Bryan's question because it seems like there may be an easy answer here, because I've heard what Senator Yancey has said and his, I guess, solution. And it all goes to this is, what are the products that under the bill as written would be banned that you would not be able to sell? And to explain, if they are, I guess, over the 0.3 or whatever it is, what's wrong with banning those products? And so I'm going to ask it again to, what are the products that would be banned under this bill that you are currently selling?
Well, based on my understanding of the bill, it would be everything from vapables to edibles, to other consumables in liquid form, such as tinctures and stuff like that, as I understand it. But we'd need much better clarification on that.
Okay, so, and I don't know how this works, but then you would be fine if an edible or a gummy is testing over 0.3. You're fine banning that. Is that what you're saying?
I don't see a problem with that.
Okay, I don't know how realistic that is, but okay. So is the issue then with identifying what products fall into this category?
Well, that would probably require an extensive study and a list, because what you're looking at is continual innovation throughout the industry, where you've seen, as Senator Blackwell pointed out, you've got people that are, that are very smart in this chemistry arena that still fall within these guidelines, and there's nothing wrong with innovation as long as they meet the legal definition as per the 2018 Farm Bill.
So is your, I guess, objection to how it's currently written that it would ban current products and what could be coming down in future that would not allow you to sell those?
So the concern, Senator Wiggins, isn't over products that are above 0.3%. The concern is for the products that are currently being sold that fall within that line. The way the legislation is currently written,
Okay,
our
hold on.
concern is that it would cover even those products as well.
Okay, that would fall within what line?
The legal line of the 0.3%.
Okay, I think, okay, please, and I'm trying to understand. Okay, maybe he can, but he said 0.3 is the bright line.
Yes.
So I don't know that there's a gray area here. So can you explain what you're objecting to if 0.3 is the bright line?
So point three, of course, as you said, is the bright line, but the concern is, I'm specifically speaking to the way the legislation is currently written. The way it is currently written, my concern is the person who advocates on their behalf is that it would be a blanket coverall for even the stuff that's legal. We aren't saying you shouldn't be banning products that the federal government says you shouldn't be selling. We're saying the way the legislation is currently written would blanket cover the stuff that's federally legal at the time as well.
Okay, Mr. Chairman, I think Senator Yancey, Ken hasn't, I know. I did. He was former senator. He was former senator. I think he can explain that, so when the time is appropriate.
Senator Barnett.
Thank you, Mr. Chairman. I have two questions for Mr. Wilkerson. My first
sir.
question is, Mr. Wilkerson, earlier you made a statement about following the rules or regulations. If you don't, you just regulate or put yourself out of business. The problem I have with that is, in a lot of the C stores, and I witnessed this for myself, that's why it's very near and dear to me. The problem is, a lot of these stores don't mind selling to whomever walked through the door, whatever product that they want. And most of the time it's in neighborhoods of people that look just like me. And that's why I have a problem there. Not only is because it's people that look like me, but it could be anyone's children in any community, anywhere in Mississippi or anywhere in the United States. It's the children that I'm concerned about. And the problem that I see with most of these is that the individuals who are running these stores don't own the building. They may own the business. And if they're fine, then they just change the business over to someone else's name, and the business keeps going, and the same things keep happening. So my question is, would you be okay if there was an opportunity in this legislation to say that whether you own the building or not, if this site or this location is fined, then after a certain amount of violations, then not only this particular location can't be open for a while. I think that will help some, because the landowners or whoever owns the property may not be aware of what's going on, but if they are, then they would also make sure that what's going on in those particular stores is in accordance to what the state law says should happen. Second question is, on the packaging of these items that's being talked about, do you all make sure that these items are not targeting children in the packaging? Because some of the packaging may look like children candy here or something, that makes kids want to come in by. So can you answer those questions for me?
Yes, sir, I can. All right, so the first question, when I could go into far more detail about the licensing, and that licensing happens to be for that particular product, because as you know, many of these shops have different revenue streams that make up their business. So if they have a license for this particular product and they blow it with that, then they can no longer sell that product, which may not necessarily put them out of business, but if that's what their entirely livelihood depends on, then that's on them. For example, say like any convenience store or something along those lines, there are other product streams available for them, but for this particular product, if you get 3 strikes on that, then you can no longer sell that product. So that may not necessarily put somebody out of business on that. And then for people who are familiar with me up here in the Capitol, I've been pushing very hard for vape legislation that not only takes care of stuff like that, but the other thing is it also ties it to these particular business owners so that they can't do a quick handoff and move it over to to a family member or a family friend or something along those lines. So does that answer your first question, sir?
No, sir. Your answer was that if they sell a specific product, but if I'm not wrong, if they're caught selling cigarettes, regardless if it's Marlboro or Newport or Winston or whatever it is, to underage, then they can't sell tobacco. So why can't it be the same thing for those products? Tobacco is tobacco, hemp should be hemp, or marijuana should be marijuana, or whatever the item is being sold. If you're selling something that's not that you shouldn't be selling, then I think that you shouldn't just use the part, but you should lose the whole.
Okay, I understand what you're saying. So their entire business is at stake on that license is what you're saying, if I understand you correctly now.
Exactly. I mean,
Okay.
if I know that I'm gonna get caught selling Coca-Cola, which is a soda, illegally, and I got Pepsi and RC and the rest of the brands in there, who cares if I lose 1 out of 10? I got 9 left to sell. But if I'm illegally selling the 1, then I know that this affects the other 10, then I know that, hey, I can't do this because I'm at risk of losing the whole 10 and not just the 1.
Understood. And yes, sir. And these fines should be exceedingly high, especially when selling to kids. You've got to hit them in the wallet as hard as possible.
Yeah, but if you're gonna hit them in the wallet with 1 product and I got 10 more to sell, then I really did hit you in the wallet.
Well, sir, if like your Coke analogy, right, you've lost the right to sell all of that particular industry. Am I missing something?
So Senator Barnett, I think the part that we were talking about earlier, and I mentioned this in my first comments, is that we are pro putting folks who do bad business out of business, period. That's simple, plain and simple. If you're selling to kids, you shouldn't be doing business with anybody in general. And so that's part of what we would be behind in supporting legislation that said that. I completely understand where you're coming from with that. For the folks that I represent, the way their shops are set up, whether it's a convenience store or retail shop, it's already behind the counter. So they have to see you when you come into the store. And so they can look at you and tell whether you're underage. 2, they're going to check your ID and make sure you're 21 and older. And it's not in an easily accessible enclosure. Now, I can't speak to all of the folks that are out there. I'm sure that there are some folks who are bad actors. Folks who are selling to kids underage should absolutely be put out of business.
To your second question, Senator, absolutely there is a problem with child appealing packaging. I've always been against that. And so this body, possibly through whatever agency that this body deems through legislation, should look at child appealing packaging. And I support that, absolutely. They shouldn't be targeting kids. It's the same thing with vapor products. You shouldn't be making child appealing products at all.
Senator Yancey.
They're not going to accept me when I go back down there. I'm going to tell you that you're hurting me.
They have no idea what goes on this end of the hall. They'll never know.
So the question here it is simply. The question is, when do you test the hemp? When do you test it? And so the 2018 Farm Bill says it has to be under 0.3% THC by dry weight. Okay. What we're saying is 0.3% at finished product. So it's the difference in green bananas and ripe yellow bananas. They are testing it when it's green and saying this is the point it's acceptable as an adult. And then they're selling it as a ripe yellow banana that has much more THC than it should have.
Seeing no further questions, I think that's a good place to stop. Thank you. We appreciate your coming and
Thank you
spending
guys
time
so
with.
much for your time. Thank you very much.
Do any members of the committee or Senator Yancey, does anyone have a question or comment or a point? I don't see any. For those of you who have made presentations, are there any of you that feel there's just one thing that got left out that's really important that we hear at this point? Seeing none, I will entertain a motion that we rise and report. Before voting on that motion, I would say to the committee, personally, I believe this is a very important piece of legislation, and it's a very detailed piece of legislation, and it needs to have a lot of thought put into it before it gets in those little blue books. And I was dismayed that we had so little time on the original deadline. That's why I called this hearing as soon as I could. I think we've had good representatives of all points of view tell us essentially where they're coming from and their thoughts about this. This bill is doubly referred to finance. We have today, and I think it's been distributed to you, a copy of the House bill as it came to us. We now have a copy of the proposed Senate previous committee sub, now proposed strike all. We have an analysis, a comparison of those two that was done by our staff. I think Mr. Brown has also prepared an analysis that's been distributed to you. There also is available, if you would like it, a color-coded document that shows the additions and subtractions from the two bills. So I think that the committee at this point has a number of resources to look at this bill. You've heard the presentation today. You've had a chance, and you will have a chance to buttonhole people and talk to them and vice versa. So whenever we get around to voting on things, I expect we'll consider this bill early in the process and try to get it onto the Finance Committee. Senator Blackwell now has a thought.
Thank you, Mr. Chairman. I do have one more question for Dr. Edney, if I may.
Dr. Edney, are you willing to answer one more question from Senator Blackwell? Okay, we're in overtime now, so, yeah.
While you're walking up, you can give some thought to this. I was just wondering, do you have any numbers on hospitalizations for drug overdoses, particularly of youth, relative to some of these intoxicating hemp products?
We have pending a motion to rise and report. All in favor say aye. Opposed, no. The ayes have it. Thank you very much. Finished 17 minutes early. So the wait.